Today, I'm going to be talking to you about how to pull blood on a horse via the jugular vein. So it's very important that when you catch your horse that it's securely all around their face and it's tight and snug. And so we want to make sure that a calm person is holding your horse while you're pulling blood, just in case they spook when you insert the needle. You don't want them pulling back and hurting their neck. And so next, we're going to talk about when making a sterile field. And so her hair is pretty thick, and so we're going to trim her neck about like right here and then swipe with alcohol to make sure it's sterile. It is a crucial step to make sure that we are wearing gloves when we are pulling blood. And so today I'm going to talk to you guys about the difference between pulling blood via a hub and a syringe. And so first we're going to do the syringe, and this is sterile, so we're going to open this like this. Make sure the tip doesn't touch the bottom, and then to attach the needle we're just going to twist this off and connect it, and then twist until it's snug, and this is how you're going to pull blood via the syringe. Today I'm going to demonstrate how to pull blood via a hub. And so this allows you to put multiple blood tubes inserted so you can pull more blood without having to disconnect your syringe. So here, this needle is a little different than the syringe needle. It's still an 18 gauge 1 inch, but there's going to be needles on both sides. So we're going to put this in here and twist, and then there's a needle on the other side to insert in the jugular. So this allows the needle, it will insert into the tube, and the vacuum in the tube will pull the blood into the tube. Blood tubes come in a variety of colors that correlate to the additives inside the tube. The ones shown are most commonly used in labs. Red tubes have no additives, allowing the blood to clot, and is usually used for blood chemistries. The next 4 colors of tubes all have different types of anticoagulants added, which prevents the blood to clot inside the tube. The green tube has a sodium heparin additive and is usually used to test electrolyte studies in interior blood gases. The blue tube has a sodium citrate additive and is used to test coagulation studies. The lavender or purple tubes have an EDTA additive and is used to test hematology like CBCs, white blood cell differential, and platelet count, and many more. The gray tubes have a potassium oxalate or sodium fluoride additive and is used to test blood glucose. There are many more different blood tubes out there with multiple types of additives, but there are many commonly used in veterinary offices. So to make a sterile field, we're going to swipe the skin with alcohol, just like so. And then when holding up the vein, you're going to hold down on the bottom of the neck, and it will allow the jugular vein, to fill up with blood. Once you're able to see the vein, you're going to take the lid off the needle, insert the bevel up at a 45-degree angle. 45-degree angle. Once you think you have it, you're going to insert the tube, and if you don't have it right away, move the needle until it fills. Once you have the tube filled up to your desired length, you're going to take the tube out and replace it with the new tube. Once you have filled the tube up and you want to pull the needle out, make sure you pull the tube out first to ensure you don't cause a hematoma, and then pull the needle out and then add pressure to your injection site. Once we have the blood pulled in labeled tubes, we are able to use a centrifuge shown on the screen to extract serum or plasma that is easily stored in a negative 80 Celsius freezer until tests are ready to be run. The centrifuge will allow us to separate the plasma or serum depending on the tube additive from the blood cells. On their centrifuge, you are able to change the speed and time on their centrifuge based on what you are spinning for. For blood, the common practice is set the centrifuge at 3,600 Gs at 10 minutes. To ensure the blood runs correctly in the centrifuge, the blood needs to be balanced in the centrifuge like shown below. Once the blood has stopped spinning, your blood tube should look like this. The golden color liquid is the serum or plasma depending on if you have an anticoagulant additive. If you have a green or purple tube that has an anticoagulant, you will have plasma. Serum or plasma will be used to run a variety of tests. The common practice is to pipette the serum or plasma into micro centrifuge tubes that is correctly labeled and store in boxes of 80 in the negative 80 freezer until tests are ready to be run.